Peace, y'all. It's your girl, Nicole, Sister Midwife, and I'm coming back with another live video. Today, I'm going to talk about maternal mental health awareness, postpartum depression. It is May, which is Mental Health Awareness Month. We're almost to the end of May. And inside of this month, there was a day and a week dedicated to maternal mental health. And a lot of what we've been talking about over the course of the month, a lot of the different blogs and things that people have been talking about have really been focused on postpartum depression. So before I get into the meat of this talk today, let me just say that I do understand, I acknowledge, and I honor the fact that postpartum depression is a real thing. It is a real thing, and together as a community, as women, we have to begin supporting each other so that we can identify it, so that we can support women through it and help them through their healing process. That being said, as always, I like to bring us from the space of simply talking about awareness to really talking about prevention, because prevention is key. And how they say an ounce of prevention is worth a pound of cure, and we really have to begin thinking and talking about how do we prevent these things? How do we prevent the problems that happen when women are traumatized in birth and when women have bad birth outcomes and those sorts of things? So I'm getting a little bit ahead of myself. So let me backtrack, and I'm going to talk about kind of 3 different points that I want to cover that will talk to us about how we can prevent postpartum depression. So statistically, 20, 30, even 40%, depending on the study in which you read, of women are suffering from postpartum depression. Now, interestingly enough, if we compare that and parallel that with the number of women who say that they have been traumatized in birth, what do you know? They are parallel. So 30, 40% of women are also reporting that they feel traumatized after birth. And this is unacceptable, and it is not okay. So it fits then if we have so many women being traumatized in birth because they have been given vaginal exams by strangers, and they've been triggered into abusive relationships, or they're triggered into memories of abuse. Maybe they had a crash C-section that they didn't want, and they were triggered into some form of abuse. Maybe they were physically abused and violated in their birth process. This is happening all of the time. Evidence-based medicine is not the norm, unfortunately, in many, many hospitals. Many women are being traumatized when they leave their hospital floor, when they leave the hospital having their babies. And it is no wonder with so much birth trauma that so many women are then saying that they are having postpartum depression. It goes hand in hand. And so I know a lot of you might be saying, well, so-and-so didn't have birth trauma and she has some depression. There are so many different reasons that postpartum depression can happen for different women. It is not one simple thing. There is like a layer of triggers that can happen, right? So another thing that I want to mention is this thing we call Pitocin. So Pitocin, synthetic oxytocin, is one of the #1 medications that will be used in hospital birth. It is literally one of the #1 medications used in hospital birth, and it has been directly linked to an increase in postpartum depression. So if you are going to the hospital and you are being induced, in that induction you're having increased cervical exams, and during that induction you end up with an emergency C-section. So now we have 2 assaults. We have the ingestion of this synthetic oxytocin, and we have a traumatic birth experience together. Yeah, you're going to have some postpartum depression. These things happen. And this is another one of the reasons why so many women are having difficulty after babies. We are not following the normal physiological design for giving birth and in postpartum care, which brings me to my 3rd point. What's happening in the postpartum period? Where are our villages? Where are our sister circles, our support systems? One of the main reasons why many women fall into a depressive state is because they're not being supported adequately and sufficiently in their postpartum period. I see them in Walmart at 1 week postpartum holding a little bitty baby. I see them running errands back and forth. I see them going to pediatric appointments. I see them having to go to a WIC clinic and all of these different things. We have got to create circles of love around new mothers so that they can enter their matrescence and enter their new space with their new babies and have time to bond, to heal, to experience, to breastfeed. Many of the breastfeeding problems that lead to postpartum, because you know breastfeeding in and of itself is protective for postpartum depression. If a person is having a successful breastfeeding experience, they have less postpartum depression. But when you're not breastfeeding well, you're having complications and there is no support. There are no people who come to your home to support you through breastfeeding. There's not a doula who does home visit. There's not a lactation consultant who does home visit. And so now here you are having to wrap up your baby at 2 weeks postpartum, 1 day postpartum, 4 days postpartum, whatever it is. It's too much to have to take your newborn baby out of the house to go into a facility to get support from something that should be supported at the community level. So what can we do and how can we prevent different things? Number one, we have to create our sister circles. If you had a baby last year and you felt unsupported and you realized that you would have appreciated somebody bringing you some food or doing some laundry or keeping your toddlers for a little while you were with your newborn baby, do that for somebody else. We understand that everybody doesn't have an opportunity to do everything. Everybody cannot be a postpartum doula, but you can cook an extra pot of red beans to bring to your sister friend who you know had a baby. You can pick up a load of towels and wash them, fold them, and bring them back already together. You can go over and pick up the toddler and hang out with the toddler for a few hours so that she can have special quiet time with her newborn. So that's one solution. What is another solution? How about you stop getting induced? Don't get induced. There are very, very, very few medical indications where a woman has to absolutely be induced. I'm not going to talk about that here. That's another video. But I promise you, when you get Pitocin, the research is showing us that synthetic oxytocin, which is the #1 medication that they're going to use in an induction, it is directly linked to postpartum depression. Say no to the oxytocin. You are already in labor. Why do you need to be augmented? They will try to augment you. They want to augment you, speed up your labor, and they'll give you this Pitocin. We know that it is linked to postpartum depression. Just say no. And then the last thing I can say is pick the right provider. Pick the right hospital. Birth trauma is real. Birth trauma is real. And when we have 30 to 40% of Black women leaving their birth experience feeling traumatized, then it stands to reason that we will also have 30 to 40% of Black women experiencing postpartum depression. We have to begin talking about prevention. We have to start moving differently in our pregnancies and the type of experiences that we have so we can prevent this postpartum depression. It's not all preventable. There will be some people who will even have traumatic births that are not preventable. But the vast majority of this can be prevented if we move into understanding that birth is a physiological process. If we understand that how we conceive, how we are in pregnancy, and how we give birth impacts our lives today and in the future. When we understand that birth is the revolution and we shift the vibration of how we give birth, we can change so much about everything in our lives and our communities, and we can also put a dent in postpartum depression and mental health. Thank you so much for listening. I'll talk to you later. Peace.